Howard P. Goodman, author of the Staying Sober Handbook and primary therapist at the Prominence Treatment Center in Calabasas, California. Not only is he hands-on with his clinical responsibilities, but always accessible and one who walks his talk. Embracing sobriety, Howard relates to everyone. Today he sits with Recovery Today host Sherry Gaba to discuss sobriety and the Prominence Treatment Center.
So ordinarily, SOBA is a 12-step program.
That's right.
You know, and Prominence is part of the SOBA family. And I understand that Prominence is non-12-step, and so I'm wondering what that would look like. What does that mean?
It's a great question because oftentimes people make this distinction between 12-step and non-12-step. Prominence has taken the position that they want to treat the whole client. So we've developed a whole or holistic model of treatment, which doesn't necessarily reject 12-step. It's inclusive along with a lot of other new approaches. You know, in the last 25 years, we have learned more about treating addiction than we have in the previous 2,500 years. So Prominence's goal in all this is to create a program that treats the whole client individually.
So if someone was looking on their Google and they're looking for a rehab, they're looking for a center to send their child, or they're looking for themselves and they see non-12-step, they see Prominence, what would make them choose that versus a traditional program?
Sure. Well, depending on a number of very, very kind of individual characteristics, there are people who respond to 12-step, and that's great. For those who don't, we have programs that are built around CBT, cognitive behavioral therapy, for example. So we design a program that utilizes those tools and aligns with an organization called Smart Recovery.
Right.
Okay? For those who are less inclined to that, we can develop a program that is more mindful in nature, and they would engage in more mindful meditation work, stress reduction, body scanning, and both, there's some crossover there with new technologies like neurofeedback, which has gotten really great results for us.
So what I'm hearing you say is really Prominence is all about mind, body, spirit. It's sort of, that's what maybe what you mean by holistic. It looks at the whole person. How about trauma? What is the piece on trauma at Prominence?
Yeah. Well, you're absolutely right. It is a multidimensional program, mind, body, and spirit. And with trauma, depending on what the client responds to, we do some trauma work. We have EMDR that we provide to some clients,
Great.
Which is a best practice protocol for trauma. We also do a lot of psychodynamic kind of work as well, which is very, very helpful there. One of the things that we want to create is the kind of milieu where clients open up and develop enough trust to start healing that trauma.
Yeah,
right?
Open up and really get to the deeper layers.
Exactly.
You know, one thing about SOBA that I think is amazing is that there's so much private or one-on-one therapy. I know that groups are really important. You want to be in groups so that you can relate to others that have been through what you've gone through. But I know there's a lot of one-on-one work to be done. So is that the same at Prominence? Do they do a lot of one-on-one work?
Absolutely. In fact, the connection with the primary therapist is one of the things that distinguishes us, the amount of time that we devote to individual or one-on-one therapy. And, in our model of continuity of care, that same primary therapist works with that individual from detox right through to discharge, creating a through line that really develops a solid foundation for recovery.
So how many sessions might they expect if they were to go to Prominence?
Well, we have a graduated level system in our program. When they first come in, typically they will see their primary therapist 3 to 5 times a week.
And Prominence is a home in the Malibu area, correct?
Beautiful home.
Yeah, it's a beautiful home.
Yes.
And so do they have a lot of activities in that area? Do they do a lot of, part of getting sober, let's face it, we want to replace the addiction with something else. We want to have fun.
Yes.
So what kinds of activities, engage them in the community, engage them in life so that they can live a happy, sober-free existence?
Right. Well, you put your finger on something very important to develop sober fun as a non-using coping mechanism. We focus on that. So the first part of the day, for example, is devoted to either attending a yoga class or
great.
Pilates. We also take people down to the beach. We're about 8 miles from the sand, so they get to play in the sand, exercise, take a walk. We also give them access to a gym, as well as other alternative therapies that are not for everyone, but for example, people who respond to animals. We have equine therapy that seems to be very effective for some people. So there are lots of activities they engage in.
Yeah, they're kind of touching on every piece of the mind, body, spirit.
Yes.
Is it affordable? Is Prominence an affordable program? Do they take insurance, or is it just someone, is it one of those programs where, you need to have a few bucks?
Well, I'm on the clinical side, so I'm probably not the best person to ask that question. But what I can tell you is the barrier to entry is as low as it possibly can be.
Right. For what they're getting a real high-class treatment.
Oh, world-class, I would say, yes.
World-class. I love that. And so what would you say to someone out there still struggling with addiction if they were looking at Prominence as their treatment of choice?
I would say there has never been a better time to get sober than today. And there is not a better place on the planet, in my view, than Prominence Treatment Center. Greg and John, the owners, have done an extraordinary job of creating an environment where you can help create your own model of recovery. And recovery is a process. For those people who stumble and struggle, come on back. You're always welcome.
So it sounds very independent. It sounds very non-cookie cutter. It sounds like you're going to create something that's perfect for them.
That's correct. That our job is to create a treatment program that works for that individual, right? There's no cookie cutter at Prominence.
What about the age group? Is it anywhere from 20s on up, or is there an average age that tends to...
It's all over the map.
Yeah.
We seem to treat a lot of younger people, which is a great thing, only because the earlier we can intervene, the sooner we can help people stay sober, which is really the objective rather than getting sober. But I've treated people 18 years old. I've treated people who are 62 years old.
We're in this fight. Greg Hanley's in this fight in terms of the insurance companies not, paying for long-term care. And
Yes.
Greg's model really was all about long-term care because we know the longer someone's in recovery, the better chance they have.
Right.
So what kind of aftercare, what is the typical protocol where they go for, 28 days? What's next, and what's next?
Depending on their level of addiction, what they're addicted to, there's a detox process that is medically supervised, and that can last 3 days, 7 days, 10, whatever it takes. That's followed by 24-hour residential treatment in which they're in a therapeutic environment 24 hours a day.
In this home that they're living
in this
spectacular home.
Palace. I mean, home really doesn't capture it.
Okay.
It is a gigantic place, and it's beautifully furnished. Real focus on low stress and comfort.
Yeah.
We have a chef there who is extremely adept at cooking nutritious and accommodates people who are vegan, vegetarian.
Oh, great. Gluten-free, that kind of thing. Wow, that's amazing.
Yes. So after that primary treatment, which is about 28 days, they move to an intermediate stage that we call TSL, Transitional Sober Living.
Okay.
And this is a chance to get additional treatment outside of the facility,
Right.
24-hour facility, and allow them to get their feet wet and give them a little more responsibility and freedom, as well as continue the level of treatment.
So to leave the facility, if they have a car, are they allowed to leave and drive, or is it?
Well, they're allowed to. They go to treatment at our outpatient facility. They're
Okay.
still restricted. They can have visitors and do a lot more things, but we are very graduated in our approach.
Yeah, it
And
sounds like a very small step
Yes.
towards independence.
Right. And things move in both directions. If someone gets to TSL and is struggling, they need to come back to a little more residential. That's something that we'll do. If
Right.
not, they move on to outpatient treatment, where they have a
Okay.
sober living component. They're living in an apartment with other sober
Okay.
individuals.
Okay.
They're attending treatment during the day and then going out, getting a job, returning to school, reconnecting to the community, and starting that process of integrating themselves back as productive members of society.
As a licensed therapist, I've worked at several rehabs, and
Yes.
what I loved about, I actually started at SOBA as a therapist and life coach, and I love their aftercare. I love the discharge planning, where they really leave with a plan of action.
Yes.
So many rehabs that I had worked at did not have them leave with a plan of action, and so they're out there kind of flailing. They've had this secure, sort of environment for 30 days, and now they're out there in the world, the big world.
Right.
And what are they supposed to do? So what kind of aftercare program does Prominence suggest when maybe 12 steps isn't what they traditionally choose?
Right. Well, again, it's really not about getting people sober, but teaching them how to stay sober once they leave treatment. And so we spend a lot of time organizing creating a schedule for our clients, so that when they leave us, they've internalized all the tools that they've learned with us, and have created a sober community which they're connected to, whether that's smart recovery or
so there is some group format that they're going to be expected to follow up with.
Oh, absolutely.
Okay,
absolutely.
good, because that's really important.
And what I can tell you is, with my clients in particular, some have settled in the local area, and we see them periodically, and they come to some of our support group meetings. I have another client who is up in this remote island in Alaska, teaching Native American kids. It's so remote that they fly him in with a biplane, and he stays there for 8 months in the winter, and he's there. There's no place to go.
Wow.
But I speak to him daily.
Oh, okay. So that's the aftercare plan.
Right.
That's really an individual aftercare plan to the fullest.
Right.
Oh, that's wonderful. So what about a parent that's out there watching this and who's just, so beaten up with the pain that they've experienced having a child or loved one with this disease?
Well, I feel your pain. In fact, I am a parent with a child in recovery.
Thank you for sharing that.
And I know the heartbreak and the sleepless nights at 3 a.m, expecting the phone to ring and dreading the phone to ring to find out what your child is up to. So I was fortunate enough to get my son into treatment. In fact, I talk about that in my book, this idea of the best thing to do is to intervene early and often, that we're in a fight for our children's lives today. So I encourage you to call Prominence, get information, find out for a place nearby you, or obviously Prominence, I believe, is a great place for your kids to get sober. And act, because sitting there and wondering and worrying and becoming angry and frustrated, there's such despair in that. You don't need to do that anymore.
And, being non-12-step may be an opening for someone out there. In other words, they've tried everything. They've tried zillions of 12-step groups. It didn't speak to them.
Right.
That may be that opening that they need. Oh, non-12-step, maybe this will work, for whatever reason. And maybe that would be an entree into the 12 steps. I mean, who knows? Have you ever had somebody that comes in and they're sort of non-12-step, and then all of a sudden they realize, 12 steps aren't so bad. Maybe I want to go to a 12-step meeting.
Yeah, that's a great point. We have people who come in who loathe 12-step. It's like they just can't stand this idea of going to AA or another 12-step program. And that's fine. We'll find a way for you to get sober. There are lots of other models. And along the way, they may say, I don't care for all of 12-step, but I like the meetings, or I like the fellowship, or they'd be able to start cherry-picking those parts of recovery that the 12-step offers.
Right. Well, there's, that saying in the 12-step, take what you can, leave the rest. I mean, there's nothing wrong with just going. I say to people that are non-12-steppers, I say, just go for the social aspect, just to be with other people that are in recovery that you can relate to, that you can talk to. There's nothing more powerful than having somebody else that's been through your pain, who's been through your story.
Absolutely. And just a quick note on that, where I live in Southern California, there are 5,000 meetings a week of 12-step, of AA, not to say anything about NA and the other ones, but you will be able to find the meeting that exactly matches your needs. So you can find a meeting for atheists who are left-handed and like to play tennis. Right? Yeah, it's really that dialed down.
So what is the spiritual component of Prominence? I mean, is there a spiritual component?
There is. We work with people not only on the mental, but the spiritual is about community. The idea of connectedness.
I love that.
The great spiritual message that I happen to subscribe to is that we are all connected and interconnected.
Part of something bigger and greater.
And we get to define what that is, but part of addiction is this alienation, this separateness, this disconnecting from others. And so learning how to connect just with a community of people is a spiritual exercise.
And maybe what you profess to is a higher of power being a higher self, highest being of oneself.
Yes, an idea of a higher self, and also the sense of not a higher power, but a higher purpose. What is my purpose?
That. Yeah.
How can I add meaning and repair the damage that I've done, and add meaning to my life so I can have fun?
And again, replacing the addiction with something else, because if you don't have something to replace it with, you're just going to go back to where you were.
Exactly.
I mean, that really is true. Well, Howard, I really appreciate your time today. You really helped us understand what Prominence is about. One question
Sure.
I forgot to ask was dual diagnosis. What, some people don't understand what that is, and a lot of treatment centers call themselves dual diagnosis, but they aren't necessarily dual diagnosis. So what makes Prominence dual diagnosis?
Well, it's our recognition that dual diagnosis is a real thing in recovery, that very often people are medicating, using drugs and alcohol to medicate these underlying psychological issues. And so we have the staff and the resources to treat both. You can't treat one or the other. You need to treat both. And so the holistic approach brings in both kinds of therapy to deal with underlying issues like anxiety,
Or
depression,
Mhm.
anger,
Or the trauma piece, I would
trauma,
imagine.
bipolar, schizophrenia, all of that. We treat it all.
Great. Well, thank you, Howard.
My pleasure.